right. Welcome everyone to the July Brown Bag Advocacy session. I am so glad you guys are taking the time to be with us today. I'm really excited for our presenter. We have Dr. Kasey Claborn, who's the director of the Addiction Research Institute and principal investigator of the TxCOPE. And we are going to be talking about some really, really cool stuff that's happening in our community. And before I turn it over to Dr. Claborn, I just wanted to go over a couple of things with you guys. This is a safe place to ask questions. Please feel free to put your questions in the chat or use the raise your hand feature, and we'll make sure your questions are asked and to connect with you guys. We do have some time set aside at the bottom of the hour to go over questions and to have more of a dialogue. So if you would like to ask questions at that time, please use the raise your hand feature. Also, please make sure that you are on mute so that we can avoid any interruptions and distractions with our presenter today. If you're having lunch, please feel free to turn off your camera. I understand. And this session is also being recorded and will be put up on the Recovery People YouTube channel.
All right, great. Well, hi, everyone. Thanks for having me. I'm excited to be here. I love Recovery People, and I'm so grateful that you guys invited me to be a part of this Brown Bag Advocacy session for July.
Dr. Claborn, I think you froze on us.
This should be fine. So apologies. So today I'll be talking about a project that we've been working on at the University of Texas at Austin for about 4 years now, and it's finally live and up and running across the state of Texas. It's called TxCOPE. It stands for Texans Connecting Overdose Prevention Efforts. And the goal of this project is to develop a system that's unified, that collects data across the entire overdose, so that we then have data to drive action across our communities. So I'll be talking today about how we built this project and built this digital tool, and then also what you can expect, and also how some of the new legislation that's recently passed, how it applies to TxCOPE. So a few disclosures before we get started. So this project is funded by SAMHSA and the Texas Targeted Opioid Response Program. I also received funding from the National Institute on Drug Abuse, and I have been retained by the plaintiffs in the multi-district opioid litigation to advise on health information and technology systems to abate the opioid crisis. So you guys can determine whether or not that influences my presentation today. So first off, I want to acknowledge our partners across the last few years in the COPE project. So this has truly taken a village to build. It's been an amazing community-based project, and we've partnered with community members across El Paso, San Antonio, Austin, and Williamson County. We've led the project at the University of Texas, and then we've also collaborated with both Maven Wave and Google Cloud as our technology partners on this project. So you'll be able to see it's been, it's truly been a unique time pulling together a platform that's very robust. One thing I'd like to note is that TxCOPE won a Google Cloud Award in 2022 for potential for social impact and innovation using Google Cloud. So to give a little bit of background, I'm sure it's no surprise to anyone on this call that we're in the emergency as it relates to overdose, both nationally as well as in Texas. And in Texas, it's continuing to worsen. Recent CDC numbers have shown that we're almost at about 110,000 people dying of drug-involved overdose deaths annually now. And the fentanyl crisis here in Texas, unfortunately, is continuing to worsen as we progress. And so the way this project got started was about 4 years ago. The Texas Health and Human Services Commission's program, through the Texas Targeted Opioid Response Program, asked if we could come up with a solution to improve data as it relates to the opioid crisis and overdose here in Texas. And so we spent several years trying to, we spent several months trying to understand overdose data as it's specific to Texas. And what we found is these aren't just problems unique to Texas. These are national problems that we have with overdose data that Texas is severely by. So some of the gaps include having disparate reporting systems. So EMS doesn't necessarily communicate all the time with emergency departments, who don't communicate with harm reduction organizations, who don't communicate with medical examiners' offices. And so we don't really have a good, or we don't have a unified system that aggregates all of these different data sources for overdose related data. We also fail to track key overdose metrics, such as non-fatal overdoses, whether naloxone has been administered, and where naloxone is being distributed. And then what's most important here in Texas, don't capture data among what are called hidden populations. And I don't like the word hidden, but that's what they use in the literature. So I'm going to use that here. And what we mean by hidden populations are those individuals with the healthcare system. And unfortunately, here in Texas, that's a large percentage of individuals who experience an overdose. They don't call EMS or they don't go to the emergency department because they're afraid of legal ramifications as a result of that. And so what TxCOPE aims to do is to capture data within the community, so for people who don't interact with the healthcare system, but also to aggregate the different data sources where overdose data currently lies. So this project has three aims. Our first aim for the project was to improve overdose surveillance data in Texas. So we wanted to develop what we call a digital ecosystem, which is a very for how we actually capture data across these disparate data sources, and as well as making sure that we're collecting data from populations that are harder to reach and not necessarily captured in our traditional surveillance data sources. We also, our second aim of this project was to be able to make that data usable in order to drive community action. So we wanted to have our counties and our public health officials, our outreach programs, that they would be able to use this data and see the data in a way that is easy to inform community-driven overdose response efforts. And so ways that we're doing this is by taking all of these different data sources, ingesting them into the TxCOPE platform, and then creating data dashboards specifically for outreach programs, for example, health organizations, so that then they can use that data to inform how they allocate resources and improve our real-time outreach with the goal of improving in a more equitable manner. And then finally, over the next year, we will be continuing to disseminate and implement TxCOPE across the entire state of Texas. So what exactly is TxCOPE? So TxCOPE stands for Texans Connecting Overdose Prevention Efforts. And I encourage you guys, if you have your phones handy, take your phones out and scan this QR code. It'll take you directly to the website. You can also just go to www.TxCOPE.org and you'll be able to see the website as well. You can download a mobile app on your phone. The TxCOPE, we have a mobile app available for both Android and iPhone. And what it is it's a tool that's designed to capture real-time overdose data. And so any individual in the community can anonymously report in a safe way into the platform. And then we have mechanisms to detect duplicate data entries, and all of that data is ingested with EMS data, emergency department data, and other data sources so that we have all of the different data aggregated into one system. The goal, like I've mentioned previously, is it's using this data to drive action within our communities as it relates to the overdose response. And then also being able to use data science that will support harm reduction efforts in Texas and also hopefully improve sustainability of our outreach programs in Texas. Who enroll in TxCOPE, they have an organization-specific data dashboard where they can use that data to monitor their programs' effectiveness within the community and their impact in the community. can be used to write grants and hopefully support better funding for these efforts across the state. So I'm going to explain how we built TxCOPE first, and then I'll show you some different screenshots of what TxCOPE looks like, so you can have an idea of the platform. The very first component that really is unique for how TxCOPE was built is that it was driven by the community. So we had what are called community advisory boards who were spanned across El Paso, San Antonio, and Austin area. And these community advisory boards informed every single component of the research of TxCOPE and the development process and the design of the platform. And so we, the University of Texas, really was just the convener of this. I want to emphasize that this truly was designed and built by the community. So the way at the very beginning, the way our community advisory boards design this is that we would partner with organizations and harm reduction organizations. The goal was that we would be able to establish trust in the community. So we wanted, they recommended that we have kind of this street type vibe. So we had local street artists do all of our artwork, design the logos, design the colors. And that's really where you can see some of the artwork on this slide. The goal is that the community and people who use drugs will be able to trust the blue dot. That was the phrase that they kept using, and that this would be a recognizable logo that if you're in a community member, you'll see TxCOPE, you know it's a trustworthy platform. One of the goals of the community advisory boards was to give the community a voice to inform how the data drives action within the community. And with the data that's given to us, we are protecting the community and advocating for the community. So I won't go through this in depth, but I just wanted to highlight our community-based research strategies. We really did lead with a nothing about us without us perspective. And this came from our community advisory board members. We knew that whatever we built needed to be culturally appropriate, it needed to be feasible, and we needed to have a very sensitive design to the community. We had community representatives who included people who use drugs, harm reduction organization workers, EMS workers, lots of different stakeholders who informed how we reach the intended population, also our product design, development, and how we implement. One thing that's unique about this is data ownership is shared with the research. So all of our research data is shared with the community and vice versa. And all of our community members who are on this project help decide how we disseminate those results. They're included as co-authors on any papers and presentations that they support. And they also facilitate in the research process as well. So this is how we designed the TxCOPE platform with the community. So we did about a year and a half of what we call contextual inquiry. So long story short, that just means preliminary research. So we did field observations with outreach teams and harm reduction teams. We did a lot of stakeholder interviews. I think we did about 117 qualitative interviews. And then we also had our community advisory boards that were informing interpretation of all the data that we collected. Throughout the co-design process, so what you see in the center of the slide, we had experts, which included people who use drugs, it included harm reduction workers, it included EMS workers throughout the entire design process. So we would develop a wireframe or a design, and we would take it to each of them, ask for their feedback and interpretation, and then they would help shape what all of the features of the platform would look like, and then also how everything interacted together. And then finally, together, the academic team analyzed the data. We developed the platform based on their feedback, and we've done an iterative process where we redesigned the platform multiple times. And now we're ready to start scaling across the state. One of our research projects that is really, if you guys have time, I highly encourage y'all to take a look at this article. I'll provide the QR code in 2 slides. But this is our paper that we published in May of this year. It just came out. And it's about how we can improve harm reduction practice in the state of Texas. So all of the data and all of the research that I just mentioned went into developing this paper that was drafted by the community. So it was truly a community academic partnership. It included all of our individual interviews with stakeholders, all of our field observations. It included our scoping review of the technologies across the nation and overdose surveillance dashboards, and also talked about our co-design process with our community advisory boards. What we found through all of this work are several key research areas that over the next couple of years, we are hoping to form policy. In that paper, if you're interested in learning more, what we found is that, our Good Samaritan law really isn't comprehensive. It's insufficient. We need a much stronger, more comprehensive Good Samaritan law. Our drug paraphernalia laws limit overdose prevention efforts, particularly as it relates to fentanyl testing strips and syringe service programs. We need more stable funding for harm reduction efforts and outreach efforts. And then our public safety approach that we've taken in Texas really increases fear and isolation among the people who use drugs community. And it's a key driver for why they don't interact with the healthcare system, particularly after an overdose. We also learned that we need to make some changes as it relates to practice of harm reduction across Texas. So we found that the absence-based over harm reduction philosophy, and really, these two aren't as dichotomous as we tend to think of them. And it tends to impede practice of harm reduction across the state. We have a system of care that follows an overdose incident. So we need EMS communicating with emergency departments and communicating with outreach teams and treatment teams. And we also need to acknowledge the impact that addiction-related stigma has as it results of people who use drugs accessing the healthcare system and also being forced to access the carceral system. And then finally, and one of the most important components that came out of this paper and this research was that we really need to improve equitable distribution of harm reduction services across the state. We don't have data that really drives equitable distribution of our services. And that's something that we can improve upon, particularly with TxCOPE. As it related to developing the technology platform, and that pretty much across the board, everyone wanted a unified, standardized system for reporting overdoses across the state. They said that that's a big gap and that this would be very, very helpful in driving data into our communities to inform decision making. We knew that we needed to have data sharing across different organizations, and that for outreach teams, they needed offline capability to enter data without having Wi-Fi access. When it comes to the human touch, we had a lot of information and feedback that the most important part of whatever we build is privacy and transparency of how data is being used and making sure that we're preserving trust within the community. So those were the key things that we had in mind as we built out the platform. So what was really fun about this project is that we had the community side, which really developed a new line of TxCOPE called the TxCOPE practice side. And then we have the academic side that informed the TxCOPE science side. And so to give you an idea of what, of the robustness of the TxCOPE platform, on the science side, we have a system built out where we ingest data across all the disparate data sources that I mentioned previously. So EMS systems, emergency department systems, et cetera. We're using natural language processing and high-level data science to be able to create data visualizations, hopefully to be able to do some predictive modeling in the future. That's what we're working on over the next year. We have real-time data dashboards that are available to organizations who are in form. And then as it relates to equitable distribution of resources, also being able to analyze social determinants of health data, and then have data visualizations of overdose and trends across the state. As it relates to TxCOPE practice, so this is particularly for organizations who choose to enroll in the TxCOPE platform. We've built out organization management tools and administrative tools. We have a supply tracking system and an overdose incident report dashboard, as well as an alert system. And then also, which is available to the community at large, mental health, substance use, safer use, and how to use Narcan resources are available on the website. So this is what TxCOPE looks like. This is as an organization. If you go to the homepage at TxCOPE.org, you'll be able to see a login. After somebody has logged in, this is what the organization dashboard looks like. So for a specific organization, we're able to see top distributed supplies within that organization, how many overdose incidents have been reported into their system that month. And this is what the overdose incident report form looks like. And you can go onto the website and actually see all of the key components, but you'll notice that there are red asterisks by, you can't see all of them on here, but by about 6 or 7. These are the key data variables that are required to enter an overdose incident report form into TxCOPE, because it allows us to be able to detect duplicate data entries in the system. And that way our data is more reliable and valid. But here we collect a robust amount of information as it relates to the overdose event. We collect demographics on the person who experienced the overdose, key components related to the incident, as well as different details. So what drugs were involved? Was it fentanyl specifically, or fentanyl suspected? Was it a polysubstance related incident? We collect data as it relates to administration of naloxone and what type of naloxone, how many doses were given, were they transported to the emergency department. And all of these data inform our data dashboards. So for organizations enrolled, this is primarily for outreach organizations. We have, and all of this is free to any organization in Texas. We have a supply tracking system built out for organizations, particularly those who distribute different kits, for example, or distribute different tool supplies within the community. It allows you to track your inventory and be able to request additional supplies. For organizations who are in Bexar County only, because syringe exchange is available in Bexar County and legal, they can track syringe service exchange. If other counties will make it available to any county where it's legal to have a syringe service program. And then these are visualizations of the data dashboards. So you can see data as it relates to the state level view. Everything that I'm showing you, by the way, is fake data. None of this is real. And then you can also see at the county level. And so you'll be able to see different density of overdose incidents by zip code, where fentanyl has been detected, non-fatal overdoses versus fatal overdoses. And if you're in Bexar County, you can also see a map associated with syringe service exchange. And then we also have a public health surveillance dashboard that's more focused on the state level data. So the community version is more county specific data, this public state level data. And it just provides another way of looking at all of the different key components and variables that we collect throughout the platform. One of the unique things that's built out in TxCOPE is an alert system. And so as like xylazine, for example, if it's detected, or if there's a fentanyl outbreak or a bad batch of data, alerts can be sent out to specific zip codes and specific counties, highlighting that alert for that area. And then this is available to anyone who goes to the TxCOPE.org website or the mobile application. We have different resources that are available. So how to respond to an overdose incident, how to use drugs safer, substance use treatment resources, and mental health, all geared towards Texas specific information. And then for any interested in passing out swag, we have lots of different swag that we're happy to get to your organization if you want to help get the word out as it relates to TxCOPE. And this is just a sample of some of the swag that we have. So one thing that I really wanted to spend some time talking about, and I would love to hear feedback from you guys. I'll open it up for questions and discussion shortly. So Senate Bill 1319, which recently passed in the state of Texas, directly is associated with TxCOPE. And so one thing that's great about TxCOPE is that it was truly designed for Texas, built by Texans. And then now with SB 1319, we would love to see TxCOPE supporting this Senate bill. So what the Senate bill states is that it mandates overdose reporting for public safety purposes. EMS personnel are required to live in a jurisdiction of a local health authority or law enforcement agency that's entered into a participant agreement with an entity, so like TxCOPE or ODMAP, share data. And then it talks about the different reporting requirements. So people are required to report date, time, and approximate location of the incident and whether or not Narcan was administered. And then finally, the very last bullet point, the participant agreement for overdose mapping requires that participating local health authorities and law enforcement agencies enter into the agreement with an entity that maintains a computerized system for mapping overdoses of one or more controlled substances for public safety purposes. So I want to iterate again, this is very public safety focused. TxCOPE is very much public health focused, but we also meet the full requirements for SB 1319. Texas entities have two options that will support SB 1319. And that includes TxCOPE and also includes ODMAP. So I just want differences between these two platforms. First, TxCOPE was built by Texans for Texans, specific to Texas. It has a data-driven community public health approach, and the goal is really targeting overdose prevention to help people who use drugs, and also to reduce the impact and the harms associated with overdose. And the target data consumer are outreach teams and organizations, public health agencies. And then ODMAP is very much a public safety response program. So it was built by the High Intensity Drug Trafficking Agency in Baltimore. The goal of ODMAP is to reduce the drug supply through drug seizures, and their target data consumer is police agencies, so that it will inform drug seizures. So we both support the goals of the team, we just do so in a different manner. If you're interested in learning more about TxCOPE, or if your organization's interested in enrolling in TxCOPE, you can email us at info. You can also download the app, or you can go to the website. We have a monthly newsletter that we'll be sending out that highlights information related to overdose prevention and harm reduction across the state. And then we would really appreciate if you guys would help spread the word about TxCOPE. We're just now starting to launch statewide. And so any support we greatly appreciate. All right, so I will go ahead and stop sharing my screen and open it up for questions or discussion.
Excellent. Thank you, Dr. Claborn. We really appreciate this. All I can really say is, wow. And this is such a comprehensive thing you guys have put together, and very, very much needed. Raven, you have your hand raised. Can you come off mute?
Yes, thank you so much. And it was absolutely wonderful to see. So I have a couple nerdy questions. I'm actually a data analyst who's trying to really get more into the field of addiction research. I've been working in clinical and preclinical research for 4 years, but back in school studying counseling, so I'm trying to move into this area. So first one is, I was curious about how the duplicate entry thing was managed. I know this is sort of a granular question, but was this done automatically, or was there a system where like suspected duplicate entries would be flagged and then manually gone over?
Yeah, so we're working on fully building out an automated solution to that. We have about 3/4 of it automated, but it does require at this point, a person from my team goes in and we have algorithms built out to where, with different weights, to where it can detect the probability of a duplicate entry. And if it reaches, I think it's like 85%, then wait, I forgot. No, it's 90%. Then we go back in manually and have to determine whether or not that was an actual duplicate. So there's a manual component right now. We haven't built out the automated system to where it's reliable beyond the 90 mark. But that's what we're working on over the next year. So yes, there's a manual component to it.
Thank you. Yeah, the second question is around noting spikes and overdose rates in certain areas. So with this part, I'm curious, like, how was this measured and how much of that was automated? Like, would you be measuring it like as like a certain from a pre-established baseline for the area? Or
yeah, that was our goal. Then what we found out is that the baseline data is just not strong enough to be able to do that across the whole state. And so what we're doing right now, develop that baseline data and make it automated, is it's actually manualized and it's user specific. So, well, and in our preliminary research, we learned that EMS, they want a different threshold than emergency departments, for example. And so what we do is when we onboard individuals or organizations, we allow them to set that threshold. So if it goes above that, then they get a specific alert. Does that make sense?
Oh, I see. Yeah, so they're setting the threshold. I see. And then to that point, are the alerts automatically sent out, or?
Yeah, there are sorry, they're automated for specific alerts. So if it hits a threshold, then yes, that's automated. We also have it built out to where the TxCOPE team can send out unique alerts. So xylazine, for example, is something that's new. We didn't build it out. And so if we wanted to send alerts out like, hey, there's xylazine is showing up in this county, we can send those out manually.
That's really interesting. Thank you. And yeah, and finally, I mean, if there are any opportunities for me or someone like me to get involved and help out with this, I would be really interested. Can I just send an email to the address you sent?
Yeah, actually send it. I'm going to put my email in the chat. Send me an email directly.
Okay.
That would be great. Awesome. Thanks, Raven.
Okay. Thank you.
Other questions?
Floor is open. Questions, comments, discussion? Feel free to put any questions you might have in the chat as well. Well, all right.
Great. Well, I listed the website in the chat, and so you're welcome to see that. You can also download the mobile app, and we appreciate any feedback that you guys have.
Excellent. Thank you, guys. And with that, we will give you some time back into your day. Congratulations. And we hope that you guys have a wonderful afternoon. And again, please feel free to reach out to us if you have any questions. Thanks, you guys. Have a good rest of your day.